Hello, I'm Sebastian. Welcome to 9 Trees podcast. Today I will summarize and review the book. Healing Back Pain, The Mind-Body Connection by Johnny Sarno. MD is a landmark work in mind-body medicine that challenges the standard way many people think about chronic back pain. Drawing on Sarno's clinical experience in rehabilitation medicine, the book argues that a large portion of persistent back and neck pain is not primarily caused by structural damage, but by a stress-related process he calls tension myositis syndrome, often shortened to TMS. The central claim is that emotional conflict and psychological pressure can trigger real physical pain through changes in the body such as reduced blood flow to muscles and nerves. Sarno presents a framework that encourages readers to shift attention from fear of movement and alarming scan findings toward understanding stress, personality patterns, and repressed feelings. The book blends explanation, case-based reasoning, and practical steps designed to help readers break the cycle of pain, anxiety, and avoidance while returning to normal activity with greater confidence. I will give you key takeaways from this book. Firstly, reframing chronic back pain as a mind-body condition. A core topic in Sarno's approach is the reframe. Many chronic pain conditions, especially persistent back pain that does not improve with typical structural treatments, may be better understood through the mind-body lens. Rather than denying that pain is real, the model emphasizes that pain can be generated by the nervous system in response to psychological stressors. This reframing is meant to reduce fear and catastrophic thinking that often amplify symptoms. Sarno discusses how common imaging findings, such as bulging discs or degenerative changes, are frequently present in people without pain, suggesting that structural abnormalities alone may not explain long-lasting symptoms. From this viewpoint, repeated cycles of treatment aimed solely at the spine can unintentionally reinforce the belief that the body is fragile, increasing vigilance and disability. The mind-body model encourages readers to evaluate patterns such as symptoms that move around, fluctuate with stress, or persist despite rest and intervention. The practical value of the reframe is that it opens a different path to recovery, addressing the drivers of tension and fear and restoring normal activity rather than endlessly searching for a mechanical fix. Secondly, tension myositis syndrome and the stress pain mechanism. Sarno popularizes the concept of tension myositis syndrome, a proposed mechanism in which emotional tension contributes to physical pain through bodily changes, often described as mild oxygen reduction in muscles and nerves. The model is presented as a way to connect psychological strain with symptoms that feel purely physical. In this framework, the brain uses pain as a distraction from emotions that are threatening, uncomfortable, or socially unacceptable, keeping them out of conscious focus. Sarno links this process to stressors both obvious and subtle: work pressure, relationship conflict, financial worry, and the accumulated weight of daily responsibilities. He also highlights that the mechanism is not a sign of weakness or imagination. It is an automatic protective strategy of the nervous system. Importantly, the model suggests that chasing a perfect posture, avoiding bending, or relying indefinitely on passive treatments can keep the pain circuit active because it confirms a physical danger story. By contrast, understanding the stress pain mechanism aims to reduce the threat response and interrupt the cycle. The book encourages readers to view symptoms as reversible and to shift from symptom monitoring to emotional awareness and self-confidence. Thirdly, personality traits and emotional patterns that sustain symptoms. Another major topic is the set of personality and emotional tendencies Sarno believes commonly appear in chronic pain patients. He often points to traits such as perfectionism, conscientiousness, a strong desire to please others, high self-standards, and a habit of taking on too much responsibility. These qualities can be admirable, yet they may create ongoing internal pressure and frustration, especially when someone feels trapped between what they think they should do and what they actually want or can tolerate. Sarno argues that this conflict can generate anger, sadness, resentment, or fear that may be pushed out of awareness because they feel unacceptable or threatening to self-image. The model does not require dramatic trauma. Everyday tensions and self-imposed demands can be enough. By naming these patterns, the book invites readers to stop viewing their pain as a purely mechanical defect and instead investigate the emotional load underneath it. The intended outcome is not to blame the patient, but to give them leverage. If pain is connected to internal pressure, then reducing that pressure through insight, boundaries, and emotional honesty can reduce symptoms. This perspective also offers a compassionate explanation for why driven, capable people can be unexpectedly vulnerable to persistent pain. Fourthly, diagnosis by exclusion and reducing fear of structural findings. Sarno emphasizes the importance of medical evaluation to rule out serious disease, while also warning that a narrow focus on structural explanations can be misleading in many chronic cases. A key topic is what might be called diagnosis by exclusion. Once dangerous causes are ruled out and symptoms fit common patterns of non-specific chronic pain, the reader is encouraged to consider a mind-body diagnosis. This is paired with an argument about the limits of imaging and labels. Sarno suggests that terms like degenerative disc disease can sound alarming and may create a nocebo effect, where fear and expectation worsen symptoms and prolong disability. The book also challenges the idea that the back is inherently fragile, encouraging a return to normal movement as confidence improves. Within this topic, Sarno's message is largely educational. The reader learns to reinterpret pain signals, reduce scanning for damage, and question treatment plans that promote long-term avoidance. While the approach is not positioned as a replacement for professional care, it aims to correct a common imbalance in pain management. Too much attention on anatomy and too little attention on stress physiology and fear conditioning. For many readers, this chapter of the argument is the bridge that makes the rest of the method plausible and actionable. Lastly, a practical recovery plan centered on knowledge and behavior change. Beyond theory, the book outlines a practical method that relies heavily on education, self-reflection, and re-engagement with life. Sarno's approach can be summarized as knowledge therapy, learning the mind-body explanation deeply enough that fear decreases and the brain no longer needs the pain strategy. The plan typically encourages readers to resume normal physical activity gradually, not as reckless pushing, but as a deliberate way to stop treating the body as damaged. It also promotes attention to emotional factors through introspection, journaling, or simply acknowledging sources of anger, pressure, and worry. Readers are guided to shift their internal dialogue away from structural panic and toward a calm statement of safety and reversibility. Another behavioral aspect is reducing reliance on passive modalities that reinforce fragility while building confidence through everyday movement and routine. Sarno's method tends to emphasize consistency. When symptoms flare, the reader returns to the psychological explanation and looks for current stress triggers rather than searching for a new injury. Even for people who do not accept every part of the theory, the recovery plan offers a structured way to address stress, fear, and avoidance, which are widely recognized contributors to chronic pain persistence across many modern pain science perspectives. In conclusion, this book is best suited for people with chronic or recurrent back, neck, or other musculoskeletal pain that persists despite standard care, especially when scans and diagnoses do not fully explain the severity or inconsistency of symptoms. It can also help readers who notice their pain worsens with stress, life transitions, or high responsibility periods, and for those who have become fearful of movement. The main benefit is a shift in agency. Instead of feeling trapped by a spine label, the reader learns a coherent mind-body model that can reduce threat, lower anxiety, and support a return to normal activity. Even when someone does not agree with every proposed mechanism, the emphasis on education, reducing fear, and examining emotional load can improve day-to-day functioning and resilience. Compared with similar pain books, Sarno's work stands out for its direct, accessible argument and its practical insistence that knowledge and behavior change can be therapeutic. It is worth buying because it offers a clear alternative to endless structural fixes, giving readers a structured way to test a different hypothesis, often at low cost and with potentially high payoff in confidence and quality of life. If you would like to support John E. Sarno, MD, you can buy the book through the Amazon link I've provided in the podcast description. After reading the book, please let me know what you think and share your thoughts. See you around.